Welcome, my good friends and followers. In this wonderful session, I will be discussing the common issue that people have spoken about. Patients have asked me on several occasions to tell them the choices they could make or the option for their delivery when they have placenta previa. Placenta previa is an obstetric condition where the organ or the organ that feeds the baby is sitting just before the presenting parts. The presenting parts may be the head or the buttocks of the baby. So if the organ that feeds the baby, I mean the placenta, is below the presenting part, which is either the head or the buttocks or even the legs, if the placenta is below it and occasionally it sits just above the internal os, that is the mouth of the womb, we say that that patient has placenta previa. Normally, placenta should be at the side uterine wall and not sitting at the internal os. It should not get to the internal os. So whenever it gets to the internal os or covering it, we say that that patient has placenta previa. Now, you might be wondering why people speak about placenta previa, or why obstetricians are bothered about placenta previa. Yes, the major reason why placenta previa is often spoken about is because of its risk of causing antepartum hemorrhage and postpartum hemorrhage too. So that means that anybody who has placenta previa is at increased risk of developing bleeding before delivery, bleeding during delivery, and bleeding after delivery. So such deliveries are classified as high risk deliveries, and they shouldn't be taken for granted. Their preparations, the delivery is often prepared by obstetricians. There should be an organized plan of delivery. Now, should it be vaginal delivery or should it be Caesarean section? The truth is that there are factors that are put together to take decision. Now, there are various types of placenta previa, type 1, 2, 3, 4. For whatever type the patient has in this our environment, Caesarean section is the best option that guarantees safety for both mother and the baby. So that is my answer to that question. What route should I take if I have placenta previa? The safest route for delivery of placenta previa that guarantees safety for both the baby and the mother is Caesarean section, period. So there should not be ambiguities about it. There should not be contemplation about it. Once you have placenta previa, it is better you have Caesarean section done. Why you should have Caesarean section done is because the obstetrician who is going to carry out the Caesarean section will need to prepare ahead of time, arrange for blood, ensure that he has enough staff that will help during the surgery. There should be an anesthetist with uh, you know enough equipment for general anesthesia as well, if there should be need for that. So the appropriate preparation must be made for it, and then there should also be a neonatologist available that could help to resuscitate the baby if there is need for resuscitation. So having said so, it is not a situation where you go and start saying, I want to deliver like a Hebrew woman. No, you are not trying to show strength. You are not trying to prove anything. For your own safety, the best approach to placenta previa is Caesarean section. Leave trial of vaginal birth. Don't listen to Mama Ekpere. Don't listen to traditional birth attendant. Don't listen to anybody who pulls you that there is one maternity where you can give birth when you have placenta previa. you are setting yourself up for deaths, because you can bleed from the time of delivery till the time of death occurs. Bleeding is the most feared complication of placenta previa, so avoid vaginal delivery in placenta previa. Thank you. I will see you on the next one. Please help us to share this video so that other people will also listen to this and pay attention to that. Thank you and bye for now.